bronchopneumonia, you will find cranioventral consolidations or cranioventral lobes are more commonly affected. In interstitial pneumonia, mostly entire lung is affected. In embolic pneumonia, you will find multifocal lesions are randomly distributed in all pulmonary lobes. Okay, so here what happened? Actually, the pathogens are actually enter into the lungs through circulation. So majority of this uh, pneumonia spot are present, or they are actually present around the arterioles and capillaries, right? So mostly they are present around the blood vessels. Another important thing, embolic pneumonia are rarely fatal. They are not responsible for death of the animals, right? Because majority of the time what happen, actually else in the body, from that particular point the bacteria or other pathogens which are present at the other side, it will enter into the circulations, they will reach into the lungs, and ultimately they will produce some multifocal area of pneumonia, right? So in majority of the cases they are not fatal, and due to this reason time you will not find pneumonia. Mostly you will find chronic type of changes, right? Because what happened, as they are not fatal, so generally slowly they will get resolved, or it may be converted into the abscess, and they are not responsible for the death of the animal. So slowly the acute condition is converted into chronic conditions, and you will find at the time of postmortem, animal may be died due to certain another reasons, and you will find you will find this embolic pneumonia as an incidental finding or secondary changes. Okay, here you can see this is a photograph of a lung. Okay, and here you can see all lobes. All lobes are showing multifocal to coalescing variable sized area of hemorrhages, and this particular area of hemorrhages are actually indicative of pneumonia, right? So this particular pneumonia are showing typical symptoms like hemorrhages, or typical presentations like hemorrhages. Okay, and this is actually lung of a pig, and this is due to erythrocephalothrix ruchiopathy. Here again, here you can see a little bit this particular changes. The earlier this one is little bit recent changes, because the typical appearance of these changes are a little bit reddish in color, so they are indicative of little bit fresh changes or acute changes. But here you can see the spots are completely become dark in colors, and in center you can see white spots, so they are actually indicative of white blood cells infiltrations, as well as some area of hemorrhages that become dark in color due to degradation of the RBC. Here you can see again, this is lung, and most probably this will be the lung of cattle, right? So here you can see this is comparatively healthy area. These lobules are comparatively healthy, but if you see this dark lobules, they are actually showing area of pneumonia, as well as here you can see there are some multifocal areas which are showing area of pneumonia, right? So this is embolic pneumonia. This is also area of pneumonia, right? So if you take this particular dark color area and if you put inside the lung, it will shrink because this area is showing consolidation, right? But if you put inside the water, in that case they will not shrink because they are comparatively healthier one. Here you can see this is another picture where you can see this entire lung is affected, and all these white spots are showing area of pneumonias, and this is due to mainly infiltration of a white blood cells and probably necrosis. Here also you can see this is a lung. Okay, these are the bronchi and bronchioles. They are actually air spaces, and here you can see this is white area are actually multifocal to coalescing area of a embolic pneumonia. Here also you can see this is quite chronic change. Okay, and they are showing area of pneumonia, multifocal area of pneumonia. Okay, so how this bacteria or other pathogens will enter into the blood and it become emboli and responsible for production of embolic pneumonia. So source of septic emboli. In case of cattle, majority of the embolic pneumonia are due to hepatic abscess, right? So many times what happens, this hepatic abscess ruptures into the caudal vena cava, and due to rupture of this abscess, ultimately this bacteria will gain the blood vessels. It will enter into the blood vessels, particularly vena cava. It will reach into the blood, it will reach into the heart, and from this heart, particularly from heart, again it will enter into the lungs and it will produce embolic pneumonia. In particularly small animals, particularly young animals like calf or young ones of a sheep and goat, many a time these umbilical cords are get infected, it becomes septic, and this bacteria will enter into the circulations and ultimately it will reach into the lungs and it will produce embolic pneumonia. In other species, in other majority of the species, generally valvular or mural endocarditis of a right side heart, because from the right side heart this blood will reach into the lungs, right? So whenever there is a valve, particularly blood heart valve, when they get injured, many a time bacteria will get settled down on the injured valve and they will replicate at the site. So many times we will use the word vegetative endocarditis. Vegetation means something is growing, right? So here what happened, the valve of the right side heart is actually get affected, and due to when they get damaged, ultimately bacteria will gain that particular site. It will enter into that particular sites, it will get settled, and they will replicate at the valve. And when blood is actually moving from this particular valve, along with this blood, small quantity of the bacteria will be carried forward towards the lungs, and ultimately they will gain entry into the lungs, and they will come out from the circulations and it will settle into the surrounding alveoli, and they will produce embolic pneumonia. So in majority of the animals, particularly in pig and many other animals also, the valvular or mural endocarditis are most common cause of embolic pneumonia. Many a time in case of cattle also, this mastitis or bacteria or hoof infections are also responsible for production of embolic pneumonia. The most common bacteria which are associated with the embolic pneumonia are Trichinella pyogenes, particularly in case of cattle, Pythobacterium necrophorum in cattle, pig, and human beings, Erysipelathrix russiopathy, this is most commonly seen in pig as well as in cattle, dogs, and human being. Staphylococcus suis is most commonly seen in pig, Staphylococcus aureus in dog, and Streptococcus equine horses. Okay, so these are the most common bacteria which are associated with embolic pneumonia. The next type of pneumonia is granulomatous pneumonia, right? So granulomatous name itself indicate here there will be formation of granulomas. And what is granuloma? We have all learned in inflammation classes, right? So granuloma is characterized by infiltration of a macrophages, particularly in the centers you will find necrosis, and that necrotic tissues are surrounded by ample amount of macrophages. Many a time they become epithelioids, and you may also find multinucleated giant cells, right? So in granulomatous pneumonia, most important feature is you will find granulomas. Okay. So whenever there is a presence of granuloma may be showing area of necrosis. In some cases, you may not find area of necrosis, right? So depending upon the presence or absence of necrosis, you can say granulomas may be showing caseation. Caseation means necrosis, or it may be non-caseating granulomas. Okay, the most common etiology which is associated with the granulomatous pneumonia are Mycobacterium bovis. In other words, we can say tuberculosis, TB, right? So this is the most important disease which is responsible for granulomatous pneumonia or granulomatous reaction inside the body. Apart from that, in case of horses, Rhodococcus equi is another important pathogens which are responsible for granulomatous pneumonia, or it may also responsible for granulomatous lymphadenitis or granulomatous enteritis. Okay. Then in case of horses, as well as in some other species, fungus are also responsible for production of a granulomatous pneumonia. But most of the time, horses are more frequently affected with this fungi. The Cryptococcus Coccidioidomycosis, Histoplasma, and Blastomycosis. These particular fungi are responsible for production of a granulomatous pneumonia in case of horses. So these are the most common etiology which are responsible for production of granulomatous pneumonia, right? So bacteria, Mycobacterium, Rhodococcus, as well as fungi. Now grossly what you will find, in case of granulomatous pneumonia, there will be presence of variable numbers of causative and non-causative granulomas. And these particular granulomas are randomly distributed in lung. These granulomas are well circumscribed, means they have well defined borders, variable sized, okay, and depending upon the calcification, it may be hard or it may be firm or it will show variable texture. Here you can see this is typical lung that are showing multifocal to coalescing area of granulomas, right? So here you can see these are the granuloma. This is also granuloma, okay? These are the lung. And all this white area are actually showing infiltration of a they are also showing necrosis. This particular necrosis is surrounded by ample amount of macrophages. Many a time this due to phagocytosis, these macrophages are converted into the epithelial macrophages, and ultimately, when pathogens are strong, ultimately to kill that particular pathogens, these macrophages will fuse together and they will form multinucleated giant cells. So in granulomas, microscopically, what you will find area of center area of necrosis which contain necrotic debris as well as pathogens. Like in case of tuberculosis, you will find acid-fast bacilli in the center, and this necrotic center is surrounded by macrophages, epithelial macrophages as well as multinucleated giant cells. And these particular macrophages and giant cells are again surrounded by lymphocytes, and you will find small rim of fibrous tissue and granulation tissue along with some inflammatory cells like neutrophils that will be surround the lymphocytes, right? So if you start from the centers to the periphery, center area of necrosis that contain acid-fast bacilli, then you will find the rim of macrophages, epithelial macrophages and giant cells, then lymphocytes, then fibrous tissue along with granulation tissue and inflammatory cells. Here you can see this is cross section of the lungs of a camel, which is showing multifocal area of causative granulomas. Okay, so this all white area are actually area of granulomas, and these particular granulomas are actually showing calcification also. Microscopically, we have already discussed that microscopically what we'll find in case of granulomas, in particular any granulomas, either they involve in lung, inside the intestine or inside the lymph nodes, microscopic features are almost common. The center area of necrotic tissue are surrounded by a rim of macrophages, and many a time they are also known as epithelioid cells. Why the name given epithelioid? You have already known that whenever there is suffix oid, it means they are indicative of that particular cells are look like that, right? They are not same the cells, but they will look like that. Okay, so here what happened? Epithelioid means suffix is epithelial, and prefix is epithelium, and suffix is oid means these particular cells look like epithelial cells, right? So here what happened? When macrophages phagocytized ample amount of necrotic debris and particular lipid materials, in that case they have ample amount of cytoplasms, and when you stain with the HNE, particularly hematoxylin eosin stain, in that case that cytoplasms become eosinophilic, pinkish, right? And their appearance is become just like cells of keratinocytes, particularly which are present in the stratum spinosum. Okay, so due to this particular look, they are also known as epithelioid cells. So in simple words, epithelioid cells are macrophages that contain ample amount of cytoplasm, particularly homogeneous pink cytoplasm, so the name given epithelioid cells. And when these particular pathogens are very strong, when macrophages are unable to kill that particular pathogen, in that case these macrophages will get fused together and ultimately they will form multinucleated giant cells. So in outer just after this macrophages layers, you will find layers of lymphocytes, plasma cells and connective tissue. Okay. The next type of pneumonia is aspiratory pneumonia. Name itself indicate this is a aspiration, right? So aspiration means, in simple words, આપણે ગુજરાતીમાં શું કહીએ aspiration ને? કયો વર્ડ યુઝ કરીએ આપણે aspiration માટે? કયો વર્ડ યુઝ કરીએ છીએ આપણે aspiration માટે? આપણે અનાળે ગયું એમ, અનાળે ગયું એટલે આપણે પાણી પીતા હોય અનાળે જાય એટલે શું ચાલુ થઈ જશે? હિચકી ની ખાંસી આવવા મળે આપણને, રાઈટ? કઈ પણ વસ્તુ આપણે અનાળે જતું એટલે શું થાય? અચાનક જ ખાંસી આવવાનું ચાલુ થાય. તો એ રીતે અહીંયા પણ શું થાય છે? This is a case of aspiratory pneumonia. It means the material which should go into the esophagus, they will enter into the trachea and ultimately it will produce pneumonia, right? So aspiration means materials will enter into the trachea rather than esophagus. This is known as aspiration pneumonia, right? So in aspiratory pneumonias, what happens? Any foreign materials. In normal physiological condition, only air should be entered into the trachea, right? Only air should be entered into the trachea. But many a time what happens, due to some reasons, ultimately many a time food materials, waters or any other material, foreign material, it will enter into the trachea. And through this trachea, it will reach into the alveoli and it will get settled and it will produce pneumonia, right? So ultimately aspiratory pneumonias are due to, most commonly they are due to faulty drenching. When we forcefully feed anything to the animals, in that case, many a time that particular feed will enter into the trachea and they will produce aspiratory pneumonia, right? So the response of aspiratory materials are depend upon three factors. Okay, the first one is nature of material. Suppose if you are trying to drench water, okay, forcefully if you're trying to drench the water, in that case water is comparatively less toxic to the lungs. If they enter into the lungs, they will easily absorb from the alveoli, so ultimately it will produce little bit less detrimental effect. Okay. Second, the types and amount of bacteria that carried with it, right? So suppose if you are drenching a sterile water, in that case no major bacterial pathogens are present, so ultimately it will produce very little effect. But suppose it contain many pathogenic or strong bacteria, in that case it will reach into the lungs, it will settle into the alveoli and ultimately it will produce severe pneumonia. Okay. And third is distribution of the material into the lungs, right? So if small quantity of the material is entered inside the lung, in that case it will produce focal pneumonia. But if large quantity of the material is actually aspirated, in that case it will distribute it in many lobes of the lungs and it will produce more severe effect. Okay. But suppose if you drench oil, in that case what happen? Oil will not absorb more easily from the lungs, so ultimately it will produce more severe effect, right? So the aspiratory pneumonia are actually depends upon nature of materials, bacteria which are carried with it, as well as distribution of the material inside the lung. The conditions that are responsible for aspiratory pneumonias, that includes forceful feeding, right? So many a time what we do, many a time when animals suffer from tympani, right? ગુજરાતીમાં આપણે શું કહીએ છીએ ટિમ્પનીને?
આફરો સર.
Afro chadu, right? Afro chadu આપણે કહીએ ને, જેના અંદર એને when rumen is actually filled with the gas, when ample amount of gas is actually accumulated inside the rumen, then we will use the word tympani, right? So what we will do to relieve that particular to relieve the tympani or to treat that tympani, what we will do? Generally, owner will forcefully drench the oil, particularly mineral oils, to that particular animal. So many a time, due to forceful drenching, that mineral oils will enter into the trachea, it will reach into the alveoli and ultimately they will produce aspiratory pneumonia. So particularly in cattle and buffalo, the most common cause of aspiratory pneumonia are actually forceful drenching. Okay. And then Many a time regurgitations, these vomissions and regurgitation due to mega esophagus. Many a time esophagus become severely large, and majority of the food materials will get engorged into the esophagus, and it will enter into the trachea. Then myasthenia gravis. Myasthenia gravis is actually autoimmune disease. You can say this is type 2 hypersensitivity reactions. And here the antibodies are actually bind with the receptors which are present over the muscles. So ultimately there will be paralysis of the muscles, and due to this paralysis of the esophageal muscles, ultimately food, or particularly mouth muscles, the food will enter into the trachea. The laryngeal paralysis, this is also responsible for development of aspirated pneumonia. Then white muscles disease, many a time due to deficiency of vitamin E or selenium, ultimately there will be necrosis of a muscles, and due to this necrosis you will find aspiratory pneumonia. Then anesthesia are also responsible for development of aspirated pneumonia, right? Probably you know that whenever you go for any type of surgery, doctors will say, okay, you have to not take any feed or water in last 12 hours, right? Or particularly food in last 10 hours for and water in last 4 hours, right? So this is due to prevent this aspiratory pneumonia. Then cleft palate, when the hard palate is actually incompletely closed, in that case, whenever the young animals, particularly calf, when they go for suckling, in that case, the milk through this cleft palate, it will enter into the nasal cavity, it will reach into the trachea, and it will be responsible for development of aspiratory pneumonia, right? So many a time mouth breathing, during the mouth breathing, many a time feed will enter into the trachea, and they are responsible for development of aspiratory pneumonia. Okay, so the characteristic features of aspirated pneumonia are mostly they are localized or unilateral. In majority of the cases, when quantity is less, in that case, only unilateral lungs are affected, and depending upon the bacteria which are actually entered into the lungs through these aspiratory materials, you will find variety of changes. Majority of the case, when anaerobes are actually present, and in that case, these anaerobes will produce ample amount of toxins, and they are responsible for necrosis, liquefactions, foul smelling, and greenish discoloration of the affected tissue. In herbivorous animals like cattle and buffalo, many a time plant materials are regurgitated, and these plant materials are also entered into the lungs, and they are responsible for production of uh, pneumonia along with inflammatory reactions. Here you can see, right? So this is lung, and here you can see this particular lung is comparatively lesser affected. Here you can see almost these cranial portions and this ventral portions are more severely affected. Here you can see this entire lungs become greenish in color, right? So greenish discolorations, and this area are actually showing area of pneumonia. Okay, so pneumonia is completed. Now we'll move towards another important terms which is related to lungs pathology. So in majority of the cases, some materials, when they get accumulated inside the lungs, particularly inside the alveoli, then we will use the word alveolar filling disorders, right? Alveoli are filled with some other materials rather than air. In that case, we will use the word alveolar filling disorders. So the first conditions are alveolar proteinosis, right? When alveoli are filled with the finely granular eosinophilic materials, particularly when they are rich in protein. Second one is pulmonary lipidosis, right? So alveoli are filled with the macrophages that contain either endogenous or exogenous lipid. In that case, we will use the word pulmonary lipidosis or lipidic pneumonia. Okay, then alveolar microlithiasis, right? So many a time alveoli contain numerous calcified macroliths or small stone. Okay, in that case, we will use the word alveolar microliths. And corporoamylosia means accumulation of laminated bodies composed of cellular debris, lipid, proteins, and possibly amyloids. Right. Now we will move towards pathology of thoracic cavity and pleura. So first one is pneumothorax. Name itself indicate pneumothorax means accumulation of air or gas inside the pleural cavity, inside the thoracic cavity, right? As we know, in normal physiological condition, air should not be present inside the thoracic cavity, inside the pleural cavity. There should be negative air pressure. If air is present, then lungs will unable to get expand, right? So ultimately, that patient will unable to inhale properly, and ultimately they will show difficulty in breathing. Okay. So we have all learned that pneumothorax are produced due to atelectasis or due to emphysema. Okay, sorry, this pneumothorax can be developed due to emphysema. Okay, many a time when this emphysematous bulla, when they get ruptured, ultimately air will enter into the thoracic cavity and they will produce pneumothorax. Okay, and this pneumothorax will results when lungs are unable to expand. Ultimately, it will show atelectasis. Okay. Many a time, pneumothorax can also produce due to trauma. Whenever there is a rib fracture, ultimately air will enter into the thoracic cavity and ultimately they will produce pneumothorax. Then pleural effusions. Effusions means whenever there is a accumulation of some substance in cavities, right? In that case, we will use the word effusions. Okay. So here the pleural effusion means pleura or thoracic cavity are showing some accumulations, right? So depending upon the accumulations, you can use the word. Okay. So here you can see the words are hydrothorax, right? Hydro means water, thorax means thoracic cavity. So whenever there is accumulation of thoracic cavity, accumulation of waters in thoracic cavity, in that case we will use the word hydrothorax. Hemothorax, hemo means blood, thorax means thoracic cavity, right? So accumulation of blood in thoracic cavity. And chylothorax means accumulation of a lymph fluids in thoracic cavity, right? So depending upon the which type of exudate is present or transudate is present inside the thoracic cavity, we can use the word, right? So here you can see this is lung, okay, this is ribs, and this particular thoracic cavity is showing accumulation of straw color fluid. And if the fluid is present, which word will you use? Hydrothorax, right? So thoracic cavity is present. In thoracic cavity, fluid is present, so we can use the word hydrothorax. And in this particular picture, the etiology of hydrothorax is also present. Why this hydrothorax occurs? Anyone can say why this hydrothorax occur? Anyone? These are the lungs. This is heart. This is fluid in thoracic cavity. This is abdominal cavity. This is part of diaphragm, and this is the affected organs of hydrothorax. Anyone? Which is this organ?
Liver.
Very good. And liver is showing which type of changes? This is showing cirrhosis. This is showing cirrhosis. Cirrhosis is actually chronic inflammation of a liver, and whenever these livers are actually unable to function properly, in that case, albumin will be not produced properly. So hypostatic pressure, osmotic pressures will be decreased, and ultimately there will be exudation of a fluid from the blood vessels into the this particular abdominal cavity as well as in thoracic cavity. Here you can see hemothorax. Okay, so name itself indicate hemo means blood and accumulation of blood into the thoracic cavity. So there we will call this particular situation as a hemothorax, right? You have to remember one thing. Hemo means there should be blood, right? There should be blood. If you find fluid that is actually bloody in color or reddish in color, in that case you should not use the word hemothorax. You should word hydrothorax only. With you can say, okay, the fluid was actually blood tinged or serosanguineous. Okay, but you cannot use the word hemothorax when fluid is present and when fluid color is bloody or dark red in color, right? But when blood is present, when you show the blood clots into the thoracic cavity, then and then only you can use the word hemothorax. Here also you can see the entire thoracic cavity is actually filled with the blood, so we can use the word hemothorax. Many a time this ruptured aorta or when this heart chambers are get ruptured due to any injury like bullet wounds or when they get stabbed, in that case ultimately you will find such type of changes. Here also you can see the entire thoracic cavity is filled with the blood, so hemothorax. Now here you can see this is thoracic cavity. Okay, this is heart, and this entire thoracic cavity is filled with the whitish material, right? So this whitish material can be pus, can be lymph fluid. So if you see in the microscope this particular fluid, in that case, if they are lymph fluid, then you will find ample amount of lymphocyte, as well as they are rich in the fat droplets, right? So when you examine microscopically such type of fluids, if you are find ample amount of only lymphocytes and lipid droplets, in that case you can use the word chylothorax, right? Chylothorax are nothing but they are actually lymph fluid, and many a time when these thoracic ducts are get ruptured, in that case majority of the lymph fluids will be entered into the thoracic cavity and they will produce chylothorax. They are most commonly seen in cats and other felid animals. Okay, and if they are pus, in that case there will be foul smelling, as well as if you examine under microscope, in that case you will find variable viables and non-viable neutrophils, as well as some other necrotic debris, which is generally not seen in chylothorax. Here you can also see this is another case where you will able to find chylothorax, and this, as we have already discussed, chylothorax means due to rupture of thorax. Then pleuritis. Okay, so pleuritis means inflammation of a pleura, and according to the exudate you can again classify this pleuritis into the fibrinous, suppurative, granulomatous, hemorrhagic, or combination of this exudate, right? So here you can see the thoracic cavity contain ample amount of pus, and this pus actually deposited over the surface of lungs over as well as wall of the thoracic cavity. So the name given pyothorax or thoracic empyema, suppurative pleuritis. Here also you can see this entire thoracic cavity is filled with the pus. So pyothorax or thoracic empyema. Here you can see the entire thoracic cavity as well as surface of the lungs are actually showing severe accumulations of fibrin, right? All these yellowish materials are actually fibrin. So this is typical showing fibrinous pleuritis. Here also you can see this entire thoracic cavity is filled with the fibrin, so fibrinous pleuritis. Okay, so this is end of our respiratory system, and let's recapitulate few of the images. I would like to know your answers. Okay, so first, what will be your diagnosis, or what will be your answer in this particular image? What you are able to appreciate?
So, rhinitis.
Very good. Which type of rhinitis?
Granulomatous.
Very good, right? So this is a case of granulomatous rhinitis, and most commonly this is due to rhinosporidium. Yes, macrophage accumulation. Very good. Okay, then this one. Here you can see this is cross section of a skull of a horse. These are the brain, and the pathology is present here. Okay, anyone? What type of changes you are able to appreciate in this particular image? We have already learned this all images. We have already discussed all these images.
Guttural pouch.
Yes, very good. This guttural pouch is filled with the pus, so guttural pouch empyema. Okay, then this one.
Sir, paralysis.
Very good. Laryngeal hemiplegia or unilateral paralysis. This one.
Smoke inhalation, sir.
Very good, right? So what indicate animal will be live or dead at the time of this particular incidence?
Live.
live, right? Because when animal is live and whenever there is a fire incidence or whenever there is a fire in surrounding area, in that case what happen? The carbon particles will be inhaled and it will be deposited over the trachea as well as bronchi. So it means most probably this animal will be died due to this fire incidence. And here you can see this is esophagus. Then species and type of changes.
Emphysema.
Very good. Which type of emphysema? Interstitial or alveolar?
Interstitial.
Very good, right? So this is the case, this is lung of cattle and this is showing interstitial emphysema. And what will be the most common cause for this? In case of cattle, most common cause, etiology, the fog fever or 3-methyl indole toxicity is responsible for interstitial emphysema, as well as struggling at the time of death may also produce similar changes. Then this one, probable species कई हो सके आ रही है क्या एनिमल हो सके लंग
cattle and pig.
Cattle and very good, right? Cattle and pig. And what type of changes you can appreciate in this particular image? Here you can
Edema.
see this lobule. Yes, very good, edema, right? So lobules are separated by thickened interstitial septa. So this is a case of interstitial edema. Very good. Then this one. This is a cross section of a lung of a buffalo.
Chronic bronchopneumonia.
Yeah, very good. Along with the chronic bronchopneumonia, some another important changes which can be appreciated in this particular picture is bronchiectasis, right? So this is a case of bronchiectasis with bronchopneumonia. Very good, right? So the majority of the bronchi and bronchioles are actually dilated due to accumulation of pus. In this particular case, what you will find?
Marble shaped.
Marbling of the lung. Very good, right? So here what happened? This small lobules are separated by thickened septa and they will give typical marbled appearance. So the name given, marbled lung or marbled appearance of the lungs due to thickening of interlobular septa. This is a case of what you will find in this etiology. This is a sequestrum area of necrosis surrounded by fibrous tissue, and this is most commonly seen in interstitial pneumonia. Here in this case,
Interstitial pneumonia, sir.
excellent, right? So this is a case of interstitial pneumonia and the entire lung is involved. You will find this type of rib impressions. So it means they are showing edema, okay, as well as entire lungs are not coalesced properly due to interstitial pneumonia. Then this one, this is from today's class.
Granulomatous
What type of
pneumonia.
Excellent. This is a case of granulomatous pneumonia, and most commonly in case of cattle, they are associated with the mycobacterium. Okay, but if you find such type of granulomatous pneumonia in young fowl, then etiology will be Rhodococcus sequi, or in case of horses, this may be due to some fungal etiology also. Then this is from cat.
Chyle accumulation.
Okay, very good. Accumulation of lymph fluid, so chylothorax. Excellent. Okay, so this is all about respiratory system. Okay, so today we'll stop here.